What I'm about to tell you might feel uncomfortable, but it could protect your brain, your heart, and even your life. Every single night, the way you sleep may be quietly increasing your risk of stroke, blood clots, and heart strain. And most people over 60 have no idea it's happening. I've seen this happen too many times. Patients doing everything right during the day, yet overlooking one simple habit that silently works against them for hours while they sleep. Before we go any further, if you care about your health and want more clear, honest medical guidance like this, take a moment to like this video and subscribe. It helps more people learn what they need to know before it's too late. Now, let me ask you something. When you lie down at night, do you naturally fall onto your back? Or maybe you curl onto one side without thinking much about it? It feels harmless, even comfortable. But what most people don't realize is that your sleeping position directly affects your blood flow, your breathing, and even how your heart works through the night. As we age, the body becomes less forgiving. Blood vessels stiffen, circulation slows, and the heart has to work harder than it used to. This means that small choices, like how you position your body for 6 to 8 hours, start to matter far more than they did in your younger years. I've had patients who exercised regularly, ate carefully, and still ended up facing serious cardiovascular issues. When we looked closer, something surprising came up again and again. Poor nighttime positioning that placed subtle but constant strain on the heart and blood vessels. The truth is, your body doesn't switch off when you sleep. In fact, some of your most critical recovery processes happen at night. Your brain clears toxins, your heart rate adjusts, your blood pressure shifts. And if your position interferes with any of this, the consequences can build quietly over time. You might wake up feeling fine, maybe just a little stiff, maybe slightly tired. But beneath the surface, your body could be sending early warning signs, signals that are easy to miss if you don't know what to look for. And that's exactly what I want to help you understand today. Because once you see it, you can't unsee it. And more importantly, you can change it. Most people don't realize how deeply sleep position affects blood circulation, especially after the age of 60. What feels comfortable in the moment isn't always what your body needs long-term. Let me explain something important in a very simple way. Your heart is constantly working to pump blood throughout your body. When you lie down, gravity shifts and blood flow redistributes. This is completely normal, but certain positions can either support that process or make it harder. Sleeping flat on your back, for example, may seem harmless, but in many older adults, it can allow the tongue and soft tissues in the throat to relax backward. This can partially block the airway, even if you don't have diagnosed sleep apnea. When that happens, oxygen levels may drop slightly throughout the night. Now here's where it becomes more serious. When oxygen levels dip, even mildly, your body reacts. The heart has to work harder, blood pressure can fluctuate, stress hormones may increase. Over time, this repeated strain may contribute to cardiovascular issues, including a higher risk of stroke or irregular heart rhythms. I've seen patients who had no idea this was happening. They weren't waking up gasping for air. They weren't aware of any problem. But subtle fatigue, morning headaches, or a sense of unrested sleep were clues their body was struggling overnight. What I'm about to tell you might surprise you, because it's not just about breathing. Blood flow itself can be affected by how you position your body. When you lie in certain ways, pressure can build in veins, especially in the legs or upper body. This may slow circulation slightly. Over long periods, reduced circulation can contribute to clot formation, particularly in individuals already at risk. And here's the difficult part. These changes don't happen overnight. They build gradually, silently. You don't feel a clot forming. You don't notice your circulation slowing, but your body knows. And it tries to adapt until one day it can't compensate anymore. This is why small adjustments, ones that feel almost insignificant, can have a meaningful impact over time. Because prevention doesn't always come from big changes. Sometimes it starts with something as simple as how you lie down tonight. I've seen this happen too many times. People focusing on diet, medication, even exercise, yet completely overlooking the hours they spend asleep. And those hours matter more than most realize. Let's talk about one position that often gets recommended, but isn't always ideal for everyone: sleeping on your right side. Now, you might have heard that side sleeping is generally better than sleeping on your back, and in many cases, that's true. But what most people don't realize is that which side you choose can make a difference. When you lie on your right side, the position of your heart changes slightly within your chest. For some individuals, especially those with certain heart conditions, this position may place subtle pressure on the heart and affect how efficiently it fills and pumps. It's not something you would feel immediately. There's no sudden pain or clear signal. But over time, this positioning may contribute to discomfort, mild shortness of breath, or even a sense that your sleep isn't as restorative. Now, this doesn't mean sleeping on your right side is dangerous for everyone. That would be an oversimplification. But for many older adults, particularly those with existing cardiovascular concerns, it may not be the most supportive option. What I'm about to share next is something many people overlook completely. Your lymphatic system, the system responsible for clearing waste and toxins from your body, also works more efficiently in certain positions. This system doesn't have a central pump like the heart. It relies on movement, gravity, and body positioning. During sleep, your body uses this system to help remove metabolic waste, including substances linked to cognitive decline. When positioning supports this natural flow, your body can do its job more effectively. But when it doesn't, waste clearance may become less efficient. Again, this isn't something you'll notice overnight. It's subtle, it's gradual. But over years, these small inefficiencies can add up. And when I speak to patients later in life, many of them say the same thing. I wish I had known earlier. That's why this conversation matters. Because you still have time to make a change that supports your body, not works against it. Now, let me share something that may change the way you think about sleep forever. There is one position that, for many older adults, may better support circulation, heart function, and even brain health. Sleeping on your left side. What I'm about to tell you might surprise you, because it's not just about comfort. It's about how your internal organs align and function throughout the night. When you lie on your left side, your heart is positioned in a way that may allow for more efficient blood flow. The large blood vessel called the aorta curves to the left, and this position may help reduce resistance as blood moves from the heart to the rest of the body. In simple terms, it can make your heart's job a little easier. For someone younger, this difference might not matter much. But after 60, when the cardiovascular system becomes more sensitive, even small improvements in efficiency can be meaningful. I've had patients who reported feeling less pressure in their chest, fewer nighttime awakenings, and even improved sleep quality after gradually adjusting to left-side sleeping. It's not a miracle cure, and I want to be very clear about that, but it's a supportive habit that may help reduce strain on the body. There's more. Sleeping on your left side may also help reduce acid reflux. When stomach acid flows upward into the esophagus, it can irritate the lining and disrupt sleep. This position uses gravity to help keep acid where it belongs. Better sleep, in turn, supports heart health, blood pressure regulation, and overall recovery. And remember what we discussed earlier, your lymphatic system. Research suggests that certain side sleeping positions may support the brain's waste clearance processes. While this area is still being studied, early findings indicate that side sleeping could be more beneficial than lying flat on your back. Again, this isn't about fear. It's about awareness, because once you understand how your body works, You can start working with it instead of against it. And sometimes, the simplest adjustments are the ones that quietly protect you the most. But here's something important that many people overlook. Even if you choose the right side, how you position the rest of your body matters just as much. I've seen patients switch to left side sleeping, yet still wake up with discomfort, stiffness, or poor sleep quality. And when we look closer, the issue isn't the side, it's the alignment. When your head, neck, and spine are not properly supported, it can affect more than just comfort. Poor alignment may interfere with breathing, circulation, and even nerve function. For example, if your pillow is too high or too low, your neck may bend unnaturally. This can subtly restrict airflow or create tension that disrupts sleep cycles. Over time, fragmented sleep can place additional stress on the heart and metabolic system. What I'm about to tell you might seem simple, but it's incredibly important. Your head should be in a neutral position, aligned with your spine, not tilted sharply upward or downward. Your shoulders should be supported, and your hips should remain stacked, not twisted. Some people find that placing a small pillow between the knees helps maintain proper alignment. This can reduce pressure on the lower back and improve overall comfort. And here's something many don't expect. Your arms matter too. Sleeping with your arm tucked tightly under your body can restrict blood flow and create numbness or tingling. It might seem minor, but over time, these small disruptions can affect how deeply you sleep. I've had patients tell me they thought their restless sleep was just part of aging, but once they adjusted their positioning, they experienced noticeable improvements, not just in comfort, but in how rested they felt. Because quality sleep isn't just about duration. It's about how well your body is supported during those hours. And when everything is aligned, your breathing, your circulation, your posture, your body can finally do what it's designed to do: repair, restore, and protect. Now let's talk about something that often goes unnoticed, yet can quietly increase the risk of serious health issues: prolonged pressure and reduced movement during sleep. As we age, the body naturally becomes less mobile during the night. You may not shift positions as frequently as you once did. And while that might seem like a sign of deeper sleep, it can sometimes create areas of prolonged pressure in the body. When certain areas, like the legs or hips, remain compressed for long periods, blood flow can become slightly restricted. In most cases, the body adjusts. But in individuals with slower circulation or underlying health conditions, this may contribute to pooling of blood in the lower extremities. And this is where awareness becomes critical. Blood that remains stagnant for too long has a higher chance of clotting. Again, this doesn't mean it will happen, but the risk can increase under certain conditions. I've seen patients who were otherwise healthy develop circulation-related issues simply because their nighttime habits didn't support movement or proper positioning. What I'm about to tell you is simple but powerful. Even small movements during sleep, natural shifts in position, help maintain healthy circulation. This is one reason why extremely rigid sleeping setups can sometimes work against you if they prevent natural movement. It's about balance. Support your body, but don't restrict it completely. Some people find that using a supportive but not overly firm mattress allows for gentle repositioning throughout the night. Others benefit from consciously adjusting their position when they wake briefly. And here's something important: hydration. Dehydration can make blood slightly thicker, which may affect circulation. Ensuring you're adequately hydrated throughout the day can support healthy blood flow at night. Again, none of this is about fear. It's about understanding how small, everyday habits interact with your body's natural systems. Because when you start paying attention to these details, you begin to see a bigger picture, one where prevention isn't complicated, it's consistent, and it's within your control. I want to leave you with something that may stay with you long after this video ends. Most people don't realize that the body whispers before it shouts. It gives small signals, subtle discomfort, restless sleep, mild fatigue, and it's easy to ignore them, to assume they're just part of getting older. But I've seen this happen too many times. Those early signs were not random. They were clues that something needed attention. The way you sleep is one of those areas where small awareness can lead to meaningful change. You don't need expensive treatments or complicated routines to start supporting your heart and circulation. You just need to be intentional. Tonight, when you lie down, notice your position. Notice how your body feels. If you've been sleeping on your back or your right side, consider gently transitioning to your left. Use pillows to support your alignment. Allow your body time to adjust. It may not feel natural at first, and that's okay. Change doesn't have to be sudden. It can be gradual. What matters is consistency. Because over time, these small adjustments may help support better circulation, improved breathing, and more restorative sleep. And perhaps most importantly, they may reduce strain on the systems that keep you alive and well. I'm not here to promise outcomes. I'm here to share what I've learned, what I've seen, and what may help you make more informed choices. Your health is not defined by one habit, but it is shaped by the patterns you repeat every day and every night. So pay attention, listen to your body, and don't wait for a wake-up call that comes too late. Because sometimes the most powerful changes begin in the quietest moments, like the way you choose to sleep tonight.